or has been organized by our disability working group. So the IHSP, Jonas Sebastian Baudry, one of the faculty members at the Institute, leads this working group, and we're happy to have Addie Goldiner here with us today to speak about moral accommodations, tolerating workplace misconduct due to a disability. Promises to be a fascinating talk. I'm just going to pass it off right now to Jonas to moderate the talk. And I want to let everyone know that there will be a good discussion period at the end of the talk. So please just put any comments you have any questions you have into the chat, and we'll be able to have a good discussion at the end. So just to introduce Jonas Sebastian Baudry is assistant professor here at McGill, jointly appointed at the Institute for Health and Social Policy and within the Faculty of Law. He teaches and researches in disability law and, health law, disability studies, legal theory, and human rights. So pass it to you, Jonas.
Okay, well, thank you. Thank you, Jen. So, hi, everyone. So thanks for taking the time to come to this webinar. So on the ethics and theoretical foundations of disability policies. So I'm very pleased to introduce our speaker, Dr. Addie Goldiner from King's College London, who will talk to us about the kind of morality and extent of accommodations that may be provided to people who behave in ways that may be construed as inappropriate in the workplace. Dr. Goldiner was recently awarded her PhD in law from King's College London. She also holds an LLB from Tel Aviv University and an LLM from Columbia University, which she graduated with well, I hope I got this right, that you graduated with high regards in some ways. And so your research interests lie at the intersection of disability law. Sorry, there's Alex Baker that would need to be ejected from the audience. He's making, thanks, Anaik. It took my focus away for a minute. So yeah, great. So her research interest lies at the intersection of disability law, philosophy of law, and disability theory. Prior to pursuing postgraduate studies, Addie practiced law with the Israeli Ministry of Justice and NGOs specializing in disability and anti-discrimination law and women's rights. So Dr. Goldiner will present for about 30 minutes, and there will be plenty of time for question and discussions afterward. So don't hesitate to write question in the chat as you have a question that come to you, and I'll keep track of those. And if you prefer to ask questions yourselves after the chat during the question period, you can use the raise your hand function and or mention it in the chat that you wish to speak, and I'll take note of it. So I'm turning it to you, Addie.
Thank you very much. I'll just put my presentation up, and then I'll okay. So thank you very much for the introduction, and thank you very much for having me and for inviting me. And I'm really excited about sharing this with you. This is work in progress, so I'm more than happy to hear your feedback, your comments, your thoughts after the presentation. So this talk is about how employers should respond to workplace misconduct when the misconduct itself is linked to the employee's impairment. And I want to focus on a specific kind of misconduct, not every misconduct, but just misconduct that has to do with interpersonal relationships. So no stealing, no drug use, just the way that people interact with one another. And I want to suggest that we try to understand this question within the framework of the right to workplace accommodations, which entitles persons with disabilities to certain adjustments in their surrounding environments that ensure their participation in the workplace on an equal basis with others. Let me just outline what I will be talk about today, and then we'll go ahead. So I will start with explaining the nature and scope of the problem of impairment-related workplace misconduct. And I will do so by focusing on a paradigmatic example of employees with a specific psychiatric condition called borderline personality disorder, which is often associated with disruptive behavior of the kind that I want to address. Then I will introduce the idea of moral accommodations and its theoretical justifications. Then I will show that courts, I'll go to discuss a little bit the legal aspect, the ADA jurisprudence under the Americans with Disabilities Act. And I will show that courts in the United States rarely grant moral accommodations under the Act. And accordingly, they reject claims that turn on impairment-related workplace misconduct. I will criticize this approach and argue that legal decisions in such cases rest on a misguided conflation of rights and sympathy or charity. And then at the end, I will raise one objection to my argument, one of many objections that can arise, but I do not have time to address all of them here, and maybe later in the Q&A. And according to this objection, one can argue that moral accommodations impose an undue burden on employers and co-workers and are therefore unjustified. And I will respond by arguing that even if in some cases moral accommodations impose an undue burden, it is not the case in all circumstances, and therefore a case-by-case analysis is warranted. Okay. So let me start off by explaining the problem and its scope. The problem, put simply, is that for some people, their behavior is significantly affected by certain medical conditions or features that I refer to as impairments. The paradigmatic example I want to focus on, as I mentioned already, is borderline personality disorder. It is a psychiatric condition characterized by rapid shifts of mood, impulsive behavior, dichotomous black and white thinking, so thinking you're either with me or against me, I either love you and idolize you or I hate you. People with this condition do not, by and large, have reduced mental capacities. In fact, some people say that they're very intelligent, they're very creative, and they therefore flourish and excel in work environments. However, this condition is often manifested in a tendency to generate conflicts. So they can lash out in angry outbursts, they can use verbal violence or sometimes physical violence. And therefore, this condition has detrimental effects on their interaction with others, causing difficulties in maintaining stable employment. So to contextualize the discussion a little bit more, I want to tell you about a case that I think is typical of the way in which employees with borderline personality disorder end up losing their jobs. And that's the Koia v. Vanguard case. The case was brought by Veronica Ann Koia, who worked as a graphic designer for an investment firm. She worked there for 7 years with no notable incidents, everything was okay, until she had a new supervisor with whom she had a very strained relationship. Under this new supervisor, for 5 years, she was repeatedly negatively evaluated for her inability to, and I quote, demonstrate resilience and composure, for losing emotional control in professional settings, especially when unexpected things occurred, and for being rude and disrespectful towards her supervisor and peers. During this time, she was also diagnosed with depression and BPD, and she informed her employer about her diagnosis. Nearing the end of her 5th year working with this new supervisor, she then received a particularly bad review, after which she sent an email calling her supervisor the following names. She called her lazy, spiteful, dishonest, incompetent, narcissistic, unapproachable, full of herself, and megalomaniac. She also accused her supervisor of bullying, lying about her performance, targeting her, and setting her up to fail, claiming that she started a campaign to drive her insane and created a toxic work environment. It's a very long email that is stated in full in the case. So I'm just giving you the highlights to get the the gist of the things that were said. She concluded the email with saying that she had zero respect for her supervisor, who will never acquire a heart, a soul, or common sense. After sending this email, Koia, the employee, was dismissed for violating company policies regarding professional conduct and fair treatment. Now, this case demonstrates the manner in which one's impairment manifests itself in the workplace through unacceptable behavior. And I call this kind of behavior disruptive behavior because it significantly deviates from acceptable norms of conduct. Specifically to BPD, disruptive behavior of this kind is not uncommon. Perhaps this is an extreme case, but people with this condition, because they have this tendency to perceive others as either with them or against them, it is not uncommon that they interpret normal workplace situations as personal attacks against them, and therefore they respond with verbal outbursts and different attention-seeking acts in the workplace. So the question that I want to discuss concerns the obligation we have toward employees in such situations. That is when their impairments are manifested in disruptive behavior, and I call this from now on impairment-related workplace misconduct. And just one final note about the scope of this problem. Although there are not many cases about this, I believe that this is a real problem in actual life, and probably much more prevalent than current case law reflects. And I think that's because, first of all, if we just think about borderline personality disorder, it is estimated that between 1.6 and 5.9% of the population has BPD, which is associated with this tendency to generate conflicts that naturally can also come into play in work situations. And it seems to me much more plausible that the low number of cases is due to limited access to justice. So for example, given stigma that is prevalent against people that don't want to self-identify as having this disorder, this is usually a requirement in the legal proceeding, or difficulties obtaining legal advice, or simply reluctance to engage in the legal process due to previous bad experience with the justice system. That is also pretty common for people with personality disorders. Okay. So, as I mentioned at the outset, what I want to consider is how we can address impairment-related workplace misconduct using the disability right to reasonable accommodations. Generally speaking, the idea that certain changes to the environments are required to ensure disabled people's social participation is famously associated with the so-called social model of disability. According to this model, disability is defined as the disadvantage or restriction of activity caused by a contemporary social organization. And the appropriate way to address it is through the removal of social barriers. That is, by changing our social practices and built environment to ensure people with disabilities full and equal social participation. More concretely, the social model also serves as the basis for justifying the right to reasonable accommodations in employment. Like other social barriers, employment practices also impose an unfair disadvantage on people with impairment, and therefore we have a duty to change those practices to enable disabled people's participation in the workplace. Now, reasonable accommodations in the workplace are typically discussed in connection with two broad categories. One is physical changes to the built environment, and the other is procedural changes to the standard way of doing things. So accommodations in both categories may minimize impairment-related workplace misconduct. For example, changes to the built environment, such as having quiet rooms or having less crowded workspaces, can have positive impact on people's behavior, especially when that behavior is related to stress. And also, procedural changes can minimize disruptive behavior, for example, allowing people to take time off work to seek care, or giving them time to cool off if they feel angry, or providing training to supervisors to eliminate or at least to reduce certain harsh managerial styles that can trigger responses from people with mental health issues. However, what both kinds of accommodations have in common only seek to preempt anticipated workplace misconduct. And therefore, they only indirectly address the problem that I'm trying to address here. By contrast, a third category of accommodations, which more directly tackles the issue, is what I call moral accommodations. Moral accommodations involve tolerating, to various degrees, one's disruptive behavior. And just consider the three examples that I have set here: job transfers, second chances, and exemptions. So in terms of job transfers, disabled employees may seek job transfers as a reasonable accommodation for different reasons. However, in a typical case of impairment-related workplace misconduct, transfer requests arise after the relationship with one's colleagues has deteriorated. So in that sense, they include two elements. The first is a procedural element of changing the standard way of doing things in the workplace, such as hiring processes. And the second is a moral element of suspending certain sanctions for morally reprehensible behavior, and instead providing another opportunity to comply with those standards in a different setting. The second kind of moral accommodation is second chances. Yeah, I have this notification here. What is that? Decline. Can you still see me and hear me? Okay, thanks. Sorry, I had a notification. Okay, so I was talking about second chances. Okay, the difference between second chances and is that second chances allow employees to remain in the same role, but still they build on the premise that in the future, the disruptive behavior can be avoided. They give the employee another opportunity to refrain from the disruptive behavior. The third option, the option of exemptions, is rest on the possibility that it is unlikely, or rest on the assumption that it's unlikely that the employee will be able to refrain from disruptive behavior altogether. So the moral accommodation is to exempt one from certain standards of conduct, or more specifically from being sanctioned for violating certain standards of conduct. For example, not sanctioning people who use offensive language or lash out in angry outbursts is an exemption from the standard that one has to be respectful towards one's colleagues. Exemptions thus allow an ongoing violation of such norms and are therefore the most contentious of the three types of moral accommodations. Now, the justification of moral accommodation, moral accommodations follows the same logic that underlies other accommodations. It is that disabled people's interest in social participation is sufficient to hold others under a duty to change the standard practices that follow from violations of certain standards of behavior. And I want to clarify two things about this account of moral accommodations. First of all, moral accommodations do not change the nature of the wrong committed. The behavior remains morally reprehensible, and the standard norm of conduct remains intact. This is because the right to moral accommodations correlates with the duty only to withhold sanctions that are typically appropriate responses to misconduct. So instead of sanctioning one's morally reprehensible behavior, moral accommodations mandate require us to tolerate that behavior. And relatedly, the second comment about this account is that the question of whether an individual is morally culpable for the disruptive behavior is only indirectly related to the right. If one is not morally culpable due to impairment, it might follow that we are not entitled to a range of moral responses such as blaming or resenting the individual. Perhaps it is permissible to impose certain sanctions on them. But whether or not we must tolerate one's disruptive behavior in the workplace is a different question. By contrast, if one is morally culpable for disruptive behavior in the sense that it is volitional, let's say it's volitional, but maybe harder for that person to avoid the disruptive behavior, perhaps we are entitled to a range of moral responses toward the wrongdoer. Perhaps we are entitled to blame, resent, and so on. But according to the right to moral accommodations, various sanctions of social exclusion might be impermissible nonetheless. So in other words, the argument for moral accommodations is not grounded in reduced moral culpability, but rather in the consequences of certain sanctions on the individual's interest in social exclusion. Okay, so now that I presented the problem and the idea of moral accommodations, I want to talk a little bit more about ADA jurisprudence. Generally, courts, American federal courts, reject claims of disability discrimination when those come against the backdrop of impairment-related workplace misconduct. They have different strategies of doing that. One is holding that the individual is not otherwise qualified for the job. The other one is to hold that the reason for terminating or for the adverse action was not the disability, but the misconduct. And the third one is, and so these are the two, and the third thing that they rarely consider is whether failure to provide moral accommodations was a violation of the legal duty to provide reasonable accommodations, which is an independent duty under the Act. So I will say a few words about the first and the third legal constructs, because those are the most relevant for the idea of moral accommodations. Plaintiffs have to establish that they're otherwise qualified for the job in order to make their prima facie claim of disability discrimination. They have to show that they can perform the essential functions with or without reasonable accommodations. Now, courts tend to hold that employees who demonstrate disruptive behavior are not otherwise qualified for the job. Some courts view disruptive behavior as inherently disqualifying, while others view disruptive behavior as indicative of an inability to get along with others. That's a function of the job. So the first problem with this approach is that courts incorrectly assume that an ability to get along with others is essential to virtually all jobs. And legal scholars have criticized this quite extensively. The courts tend to hold that an ability to get along with others is essential even when the employee works alone, almost entirely by herself. The second problem in these cases is that courts fail to consider the possibility of moral accommodations before determining that the employee was not qualified. So often a job transfer or a second chance or even an exemption would enable the employee to perform the essential functions of the job, perhaps including even getting along with others by either providing a more suitable environment for complying with the standard, or by exempting them from having to meet those standards of behavior and changing the marginal functions of the job. Now moving on to failure to provide reasonable, perhaps unsurprisingly, courts rarely hold that failure to provide moral accommodations is a violation of the duty to provide reasonable accommodations. Job transfers do figure prominently in the relevant case law. For example, the plaintiff in the case I described earlier requested the job transfer when she experienced difficulties with her supervisor, but her request was denied. And my research of the case law suggests that this is actually a preferred accommodation for many plaintiffs with disruptive behavior. But courts tend to reject claims that failure to provide a job transfer was a violation of the duty to provide reasonable accommodations. And they accept employers' claims that there was no available position to which the employee could have been transferred. Now, legal scholar Susan Stephan, I think, rightly argues that courts tend to reject those requests, especially because they disapprove the reason the plaintiff is requesting the accommodation, which is usually difficulties getting along with a supervisor. So they easily accept the employer's counterclaim that there was simply no other job that the person could have done or no other supervisor. With regards to, and I will say a bit more about this shortly. Now, with regards to second chances, courts typically hold that there is no duty under the ADA to give second chances. The seminal cases on this issue are typically reasoned by attributing fault to the employee. Employees are seen as responsible for failing to monitor their condition, failing to seek care, or failing to take their medications in order to prevent the disruptive behavior. So the first thing to say about this is that the focus on fault, again, brings us back to the issue of moral culpability, which bears only indirectly on the question of entitlement to moral accommodations. Moreover, this reasoning does not explain why we should reject second chances to employees who did seek care and still exhibited disruptive behavior. And in fact, legal scholars have criticized courts for adopting a strict no second chances policy, which is not mandated by the Act. Finally, with regards to exemptions, as far as my research goes, I have not seen cases in which the idea of exemptions from standards of conduct or behavior was explicitly claimed as a reasonable accommodation. And I guess it is simply assumed by both litigators and courts that exemptions are not reasonable accommodations under the IDA. Okay. So what I believe underlies courts' approach to moral accommodations is a misguided conflation of the notions of rights and sympathy. There seems to be an implicit expectation that disabled people, disabled plaintiffs, cooperate with attempts to help them without being too demanding or aggressive, that they evoke in others a desire to help and reinforce the social relationship between those who are in need of help and those who provide it. Yet plaintiffs who exhibit impairment-related misconduct are rarely sympathetic. Their aggressive and demanding behavior defies the expectation to be cooperative and patient. Their tendency to generate conflicts further erodes people's desire to help them. And they're behaving in ways perceived as manipulative, which is characteristic of borderlines, is seen as morally reprehensible. And above all, the harm they inflict on others, especially their coworkers, their supervisors, overshadows the harm that they will be subject to through further social exclusion. And so sympathy in the typical cases of misconduct is directed at the victims of the misconduct rather than at the plaintiffs. So put simply, the moral judgment of courts regarding those employees inhibits further consideration of moral accommodations. But rights are not about sympathy and help, but about people's entitlements and others' normative obligations towards them to further their interests or secure their discretion over certain domains. We can defend, and we do defend, unsympathetic right holders in exercising their rights in many other areas of morality and law. Why not disabled right holders? Moreover, in practice, and contrary to the court's blanket rejection of moral accommodations, I found that employers do tolerate, to various degrees, employees' disruptive behavior. For example, in the case previously discussed, the employee's disruptive behavior, disrespect toward her supervisor and coworkers, constant complaining and outbursts were tolerated for 5 years until her employer terminated her following a particularly extreme outburst toward her supervisor. In other words, the legal practice of failing to even consider moral accommodations in the workplace not only fails to follow our moral obligation that I argue we have toward people in this situation, but also from our day-to-day practices where employers do in fact provide moral accommodations, even if they don't do this explicitly. Okay, so now I just want to discuss briefly one objection that I think is a very big objection to my argument here. And it is the claim that moral accommodations impose too heavy a burden on employers and coworkers, and therefore it is not justified as a moral duty toward disabled people. And the same idea also appears in the law. The ADA also states that duties correlative to the right to reasonable accommodations may impose a significant burden on employers, so long as they do not impose an undue burden or hardship. Namely, so long as they do not requiring significant difficulty or expense financially, or one that is unduly disruptive to the operation of the business. In some circumstances, moral accommodations involve financial costs as well as some disruption to the operation of the business. For example, if there is a reduction in the productivity of the employee who exhibits the disruptive behavior, or the co-workers who now have to accommodate and tolerate this behavior, this can definitely lead to some problems with the operation of the business and maybe some financial costs. But it seems unlikely to me that such a cost would amount to an undue burden, strictly speaking, in financial terms. The crucial question is whether the other costs that moral accommodations impose in the form of reducing coworkers' well-being constitute an undue burden. Clearly, tolerating one's disruptive behavior can inflict harm on those around her by subjecting them to her outbursts and disrespect. But my claim is that these burdens are not always too burdensome. Remember that burden is not one of forgiving or condoning the disruptive behavior, which, if it were the case, it would be easily objectionable on the grounds that it is not feasible to compel one to forgive. And recall also the distinction between certain moral responses, such as blaming and resenting on the one hand, and imposing sanctions by denying further social participation on the other hand. The burden is only in tolerating the disruptive behavior by withholding certain exclusionary sanctions. Now, if we examine the 3 types of moral accommodations that I mentioned, it seems to me that the harm to coworkers' well-being in providing a job transfer is lesser than the burden of providing a second chance, which is in turn lesser than providing an exemption from particular standard of conduct, So there is a range. And for my purpose here, it seems enough if you accept that not every moral accommodation to an undue burden. And determining whether it is indeed an undue burden will be contingent on the particular facts of the case. That's it.
Okay, great. Well, thanks so much, Adi, for a very interesting talk. So so now we'll open the floor for questions. Let's just see first if I can allow participants to unmute themselves. There you go. There you go. So now participants should be able to unmute themselves. And so just raise your hands in the chat. So we already have a question from Daniel Weinstock. Please, Daniel, you can ask it.
Oh, thanks. Thanks very much. That was a fascinating talk. So I have a question more about you mentioned, you know, the lack of sympathy, perhaps, that, you know, towards the end of your talk, that courts might just see these sort of querulous, sort of belligerent people as not deserving. And, you know, I absolutely agree with you that rights aren't only for people that we like, but perhaps especially for people that are sort of bothersome to it. But I was wondering, so that was sort of the back end, the way in which courts might be resistant to granting accommodations because of their sense of the claimants as being kind of obstreperous and hostile. But I'm wondering about the front end. So I'm wondering, in the cases that you studied, whether there was any attempt at sort of sensitivity training within the particular firms, you know, offices, you know, so that, you know, it's very difficult, unlike other things where people are asking for an accommodation, sort of physical disability, say, or you know, pregnancy, where, you know, clearly, you know, it's easier for people to sort of separate out what it is that they have to do for this person in order to accommodate their difference from sort of like a flaw in character. Whereas when people behave in certain ways, even those of us who do have some sensitivity, it's difficult to separate out these things, right? So I'm wondering whether there's any experiences of kind of, you know, education and sensitivity training with respect to these disabilities, giving rise to greater accommodation on the ground in the particular sort of work settings that you're talking about, to sort of be more accepting of accommodation. I don't know if that's sort of clear. Just the idea that in this particular case, it's very hard to separate out behavior from character in ways that aren't the case in situations of other kinds of accommodation.
Okay, thank you very much for this question. So there are a few things I can say about this. First of all, in terms of what I saw in the case law, what employers actually do, it really varies. Some people are more accommodating. Some people take more effort to try to really help the individual. Some even so in the case that I described, there was really you can really tell that there was a lot of effort on the part of her supervisor and the supervisor of her supervisor and the supervisor of a supervisor to be involved as much as possible, to call her, to provide support, and so on and so forth. But it's definitely not so first of all, it's not always the case. And the question that I think is what I'm trying to get at with the distinction between rights and sympathy is whether they did it because they wanted to help or because they had to do it, because this is what you have to do when you have an individual with this kind of disability working with you or for you. The second issue that you raised, the distinction between character and disability, is a really interesting one. It's fascinating, especially for borderlines, because as a lot of the research about this disorder shows, it is the kind of disorder that is different from, so it really highlights there is a fine line, if there is a line, between normal and pathological. That being pathological in this case is an extreme manifestation of something that we all experience, like anger, feelings of emptiness, feeling of self-destruction. So everyone has, or almost everyone has, these feelings at some point, but in this case, in the case of BPD, it's more. And it is a fascinating question how you approach people who have this as a pathology, as opposed to people who just have an angry outburst. And I think it's a big question, and I also did some work about this question during in my dissertation. But I think that if we accept that at some point these symptoms become a pathology, and we accept that some people who have these symptoms are in fact disabled, also you can think about the way that it affects usually many, many areas of their life. So it's not only one instance or two instances of being very, very angry. It's usually something that they carry with them and that goes with them to different areas of life and harms their function in different ways. Well, of course, not everyone, but it depends. So I think that this is the kind of distinction that needs to be drawn, both in terms of morality and also when we want to apply our thoughts or our convictions about this in the law. This is what should guide us. That's my opinion.
Thank you.
Next, we have Leah.
Thank you. So can you hear me?
Yes.
Perfect. So thank you, Dr. Goldiner, for such an interesting presentation. So I have two quick questions. The first one was about, privacy issues in terms of, we always have this balance with disability-related accommodations where people are asked to a certain degree to disclose conditions and to disclose personal information about, symptoms and what they can bring, and medical option, whether or not they're compliant with medication, things like that. So there's always this line. And I was wondering, in the particular context of these disabilities that you mentioned that might trigger behavior that makes interactions with other more difficult in the workplace, I was wondering if what are the implications in terms of privacy? Do you foresee that such plaintiffs would have to disclose more of their medical condition and compliance and how the symptoms work? I'm thinking particularly for sensitivity training for supervisors. I don't see how that could be done without a full disclosure of the condition itself and, the very particular ways that it functions. So that was, I know that it's always an issue, but I was wondering what implications you could see. And I was also struck by when you talked about how the courts are often perhaps implicitly trying to view the person who asks for accommodation, they're looking for them to be grateful for the help or for the accommodation, and they perceive this as very important for sympathy reasons. And I think one of the reasons that this is so is because we start from a norm that's inaccessible, and then we view any accommodations as something that, is graciously given to someone, and so they should be very grateful about it. And so this brings me back to the idea of universal design and having perhaps a standard, a workplace that is from the starting point would be more accessible, and then we would need less individual accommodations, and then maybe this need of showing gratefulness for the accommodations would be reduced. So in terms of, universal design, I was wondering if there are any features of universal design that you can think about that might in particularly help those plaintiffs. I know they won't necessarily completely eliminate the need for individual accommodations, but I know that lots of those policies that are more universal design can lessen the need for individual accommodations. So I was just curious if you see any of those that we could apply today to workplaces to make them more accessible that might lessen the need for individual accommodations.
Okay, thank you very much for this two interesting comments. So I'll start with the one about universal design. One problem that I foresee with applying the idea of universal design to the issue of moral accommodations is that at the end of the day, we don't want to change the standard of behavior. It's not the kind of, if you think about flexible working hours, think about, oh, why grant flexible working hours only to particular people who have a disability? Why not change the entire structure of the way that our workplaces operate and just grant everyone the possibility to have flexible working? It's not the same when the standard of behavior is based in morally compelling reasons why one should behave that way towards one colleague. So it's not, if you just think specifically about about my specific account of moral accommodations, it's not immediately clear to me that we can apply this to universal design. And do in terms of universal design is something along the lines of training. So if mental health training is something that helps people understand mental health issues and then maybe accommodate those, then that can be something that we incorporate into our practices of universal design. In terms of privacy, I think it's a very good question. I don't really have an answer. I just want to say that with borderline personality disorder specifically, and I don't know about other psychiatric disorders and mental health conditions that much, one of the issues is that it's not only about like taking your medication. The process of rehabilitation and psychotherapeutic care is a long one. And once you have some kind of information or disclosure about having this condition, it's not something that you will have to then, I'm not sure. Anyway, that's what I understand from my research, but I don't think it's more, I don't know if it will be more invasive later on in specifying, oh, and now I have this drug and this medication and this medication and I have, so it's more along the lines of, okay, this is my condition, this is what I'm dealing with. And of course, in order to make people understand and tailor the accommodations to the individual, they will have to say how those conditions manifest themselves in behavior, I think. It seems to me. I hope that helps. I don't know, it's not really an answer.
Okay, thank you.
Thank you. You're muted.
Unmute. Yeah, great. Thanks for the great question, Leah. It's also a question that we got in the chat, so it's a very good question. I was thinking, waiting for others to ask questions. In terms of Leah's question and Adi's own provided elements of answer to it regarding universal design, Adi did mention that certain managerial styles, certain changes or time off, if people get anxious or nervous, and we see that in our Zoom times, right? So those could potentially be integrated in a universal way that wouldn't necessarily, of course we wouldn't, Adi made a good point, we wouldn't want to forego of expectations of mutual respect, for instance, as ideals we want to attain. But at the same time, I can see how, like Adi was saying, some kind of training and could destabilize assumptions that we have, such as the idea that a lack of emotional control is to be medicalized. Perhaps our culture grants too little importance to emotions, for instance. So there could be some work to be done in that area to argue that universal design is not so inane an idea for this. But at the same time, I was having the same reaction of how I applaud that you took such you took a hard case. You could have used other kind of disabilities that make it hard in the workplace, but you chose the one that involves many other disabilities. Depression can come from their mythology of insulting assumptions about biases of a person who has them, but you took a hard case that comes with a particular vicious mythology and with a particular and associated with harms to what you named accurately, I think, as victims. And so you took the hard case, and so I applaud that to start with. But if I would have a question to follow up myself, it would be: would you think? And of course, it wouldn't be private then. But would you think, or perhaps it could? Would you think that? Would you consider solutions of tailor-made training that could eventually ask potential victims to be part of the training, to know how to discuss with someone, for instance? Or would that be too difficult to accomplish in a way that would respect privacy? I'm thinking back, for instance, in my own experience as a stutterer. I could take it all on me to know how to manage my stuttering. But at some point when I was a kid, my speech therapist offered to come to my primary school. I decided it would be too harmful overall, but it would have involved other people around me to work with me on something that was my thing. I don't know, what are your thoughts on how far it would be part of the ADA or other laws of reasonable accommodations to expect other people, not just the employers, but other people in the workplace to get involved in that training? And then perhaps if that could be part of universal design, or still it would come with other issues that make it impossible.
Okay, yes.
There's a lot there.
So, first, let me say that, yes, it's a difficult case. It's a difficult case of a disability that is known for that is known for being not sympathetic. So also in the medical literature all around BPD, it's documented how little sympathy people have towards people with this disorder, including people who know, so including doctors, nurses, compared to all other psychiatric conditions, or at least most of the other psychiatric conditions. So I think it's a big issue with the sympathy there. In terms of what kind of training we can provide and how involved they should be. So in one of the cases that I reviewed, it was a patient who was very, she behaved in a very manipulative way, let's say, toward her doctor, who then terminated her care. But her argument was that he was not giving her, he didn't know how to cope with her, and what he needed was a guidance from her previous doctor who knew how to deal with her. So I think that in many of these cases, the people who are experiencing these difficulties are willing, well, I don't know this for a fact, but my sense is that people are willing to bring others involved, including their victims, including sometimes their carers, to get the people around them to be more accommodating, to tolerate. And also another feature that is interesting is that you see in some of these cases, it's a case where a person started working in a particular job, and problems immediately began. So problems began like 2 months after the start of the employment. But in other cases, you see that people actually did manage to work for a few years, and then problems began when a new supervisor came along. So you see that there are differences, like you said, that I mentioned, training for certain managerial styles or things like that. All of these, however, are things that aim to preempt. Well, not all of them, but some of them aim to preempt, but can also definitely underline our ability or willingness or understanding of moral actions, as I view them as something that we do after the fact.
Thank you, Eddie. Do we have any other question? Legally, morally, existential for Eddie?
I do have a question. I posted in the chat, but I'm not sure if it went through or not. I guess I can just maybe read out my question. It seems that moral norms or behavior are based in a white Western norm. How do you think intersectionality would influence court decisions in this area? For example, would Black women be more apt not to be accommodated because of this idea of the angry Black woman? So I'm just wondering your thoughts on how intersectionality may play into this in terms of legal court decisions.
So do you want to say a little bit more about the angry Black woman? What do you mean?
Sorry, I had dogs barking in the background.
I'm sorry.
It's just this idea that norms or standards of behavior are often based in white Western norms, in terms of, you know, how you may respond to a court. I'm just wondering how intersectionality may play into this in terms of folks who are non-white, where norms of behavior may be based more in culture or like just non-white Western sort of norms or ideas of morality and behavior and interactions. I'm just wondering if that would perhaps lessen a court's inclination to accommodate if the person is non-white, essentially.
First of all, let me say two things about this. First of all, I think that the idea that standards of behavior are specific standards that then if one deviates from those standards, then it warrants a different response. But those deviations are sometimes cultural deviations and not necessarily pathological, is something that is really a big issue in terms of conceptualizing the condition that we now call BPD as a pathology rather than just differences. So women, not necessarily from minority communities, but even women with certain life experiences are pathologized as having according to some critics, they're pathologized as having this disorder because of the way that they respond to harsh life experiences that doesn't really align with how society expects them to respond. So people who have been through abuse, or people who have been neglected, or people who had certain different traumatic experiences in childhood, then later develop certain behaviors that are considered extreme and unacceptable, but it's maybe not necessarily pathological, but just a different way of responding. And the second thing is that definitely what you said about the standards of behavior being a white Western construct, let's say. I come from a different culture where yelling is not necessarily about, it's not nice, but it's not considered so bad as it is in other places. And or maybe it's something that people can tolerate more. And I think that culture definitely plays a role as well. As for the question if courts will view women or different plaintiffs from intersectional backgrounds less favorably, I'm not sure, because they already kind of those claims unfavorably as it is. It's not very common that they accept it, accept these conditions as something that that we should accommodate. So I don't know if it can be more than that. One of the cases that I did find that was interesting was a case where a police officer was fired from her job after getting into drugs and having different traumatic episodes and really self-harming episodes and various disruptive behaviors. She was firing her gun, and she did many different things that led her to take time off work. But there the court said that it is not her character, it was her illness. So the court did grant sympathy toward her, maybe because of her background circumstances, the things that she was abused as a child. So I don't know how this will play out if there was a different cultural background. It's hard for me to imagine it can be any worse. That's the thing. To put it simply.
Thank you. It's an interesting dialogue, just even from a feminist perspective as well, in terms of what would we tolerate from a man versus what would we tolerate from a woman. Thank you. Yeah.
Yeah. Thanks, Adi. Thanks. Yeah, indeed, it could be. It might be a different potential prohibited grounds of discrimination when we broach on emotions that could be associated in a discriminated way with race or with gender or sex. Then it could be a different kind of discrimination or add to the disability ground. So are there other questions for Adi? Feel free to unmute yourself. Okay. Okay. Sorry. Yeah. Just okay. So okay. So I think so I will let so if there are no other questions, we will end soon, and I will hand it to Jennifer to talk about the next event. But before, I just wanted to thank Adi for this very interesting talk. Not only conceptually interesting for myself as a philosopher of disability, I just think it's really fun, it's cool, but it's also extremely important, and it has more. It has a great potential. I see it as having a great political potential beyond just the particular case that you're analyzing, and it's fine to focus on one at a time, right? But I can think of so many useful applications. For instance, in healthcare, when certain patients, let's say a patient with Alzheimer's, advanced Alzheimer's, who might become aggressive, and he might be thrown out of care because the healthcare system hasn't developed proper protocols to respond to it. There is this very widespread assumption of normalcy, of what it means to be an actor who deserves health care. And when some kind of behaviors will just cut you off from being a citizen who's entitled to life, sometime to health, right? So those are very grave issues and very real, let me assure you. So that's why I think your work is extremely important beyond for what you do and also beyond it. So thank you very much. And I'm feel free. Do you do you want to have some closing words before Jen make the announcement for the next event?
Closing words. Well, I just want to thank you again for having me. It's really interesting to hear the comments and the questions, and definitely there are many more things to think about in this context. Yeah, I look forward to just keep in touch if you want. And thank you again.
Yes, thank you so much. I just wanted to, I don't want to cut off all the discussion, so I don't know if some people are still wanting to chat, and feel free to stay in this space, but I also want to let others go on that you know, might have other things they need to get to right now. And I just wanted to thank everyone for participating, for coming to this IHSP talk. And just to let you know, we have our next seminar on December 1st. It's going to be an AI-focused talk with Jean-Christophe Bellil-Piper, who's going to speak about partnering to identify and tackle current and prospective ethical, legal, and social implications of AI-driven interventions into health policies and regulation. So I hope that some of you can join us, and thank you again to Adi. And again, I'll leave this, you know, we'll leave the space open in case some of you want to continue to.
Just to your comment, Jonas, I definitely saw many cases in which people's healthcare, access to healthcare was denied because of their behavior. It's not even about being violent. It's just about being very demanding in the way that you access care, in the way that you know, some people they refuse different things. They send lots of faxes, they send emails. It's really about taking more and more attention. They just make the caregivers, they make them impatient. They don't want to give them the help. They don't want to give them the care anymore. So I saw this as well in my work. Yeah.
Yeah, as you said, it's a matter of rights rather than creating sympathy or being yeah. Well, thank you so much. So I think that Rachel,
can I actually ask a question?
Yes, Rachel wanted to ask. Oh, hi, Rachel. Thanks for. Okay, you're that Rachel. I did not know before I saw you. Okay, hi.
Hi. I just have a question from a legal perspective. How would you balance the right of because I'm thinking about the duty to accommodate, and usually the constraints around undue hardship lie on the impact on the rights of others. And I'm thinking about how the duty to provide moral accommodations and then the employer's duty to provide a psychologically safe workplace interact in this case. And if there's any, you know, suggestions you have for mediating essentially what would be two conflicting rights in some cases.
Yeah, so I think you're right. It's a big issue. The duty of the employer to provide a safe working space is definitely something that needs to be balanced on the other side of the right to moral accommodations. I think that the point that I'm trying to make is a bit more modest, in the sense that I don't want to, you know, toss away all the work all the employer's duties to provide a safe working space. But what I want to say is that even the duty to provide a safe working space is not an absolute duty. People do not have an absolute right to the safest working place. And there are workplaces that just have a very, and we see about this in the newspaper now and then about huge corporations that have a very unsafe work environment or work culture. So I think that it's somewhere in the middle. I don't think that people have a right to the safest working. I don't think that people have a right to be completely isolated from any disrespect ever in the workplace. So I would just say of course, if the employer will be subject to liability because it subjects other employees to some kind of harming behavior, then maybe that would be a reason to, and to deny moral accommodations. But I think that in most cases, this is not the case. It is not the case in most cases. I think that in most of the cases, people try to accommodate, then they've had enough, then it's done. That's what I found.
And then maybe I'll just ask you another question. What do you think about the idea of accommodations throughout the disciplinary process? Like, I'm just thinking about in some cases where disability is directly linked to behavioral issues. I've seen cases where institutions will provide accommodations through the sanction process. So I guess that could be like more second chances or a higher gradation of levels of sanctions, or more warnings or whatnot. Yeah, I just wanted to get your thoughts on that.
Yes, I think that's what I'm aiming at. Just, even if there is no formal disciplinary process, still I'm thinking about things like that. Like maybe warnings, but maybe in a different way, maybe in a different, it really depends, I think, also on the particular workplace and what they have in place and how they operate. And I think usually the workplaces are, especially when this kind of misconduct that has to do with interpersonal relationship, the rules are not that clear cut about, you're not stealing, you're not using drugs, you are being offensive, you're being rude, you're using not inappropriate words. It's a gray, I think, area there, also for disciplinary action. So I guess it depends on the procedures that they have in place.
Yeah, it's a very good a question, Rachel, because it's true that the sanction itself, the process itself, can be, any legal process is heavy. Knowing that you're before a disciplinary, that your case is being heard is enough to make anyone anxious with a typical kind of resiliency. So if you are prone to additional anxiety or other issues, it's something to consider as well.
Right. So exactly. So when they're put on probation, and then the probation is extended in 2 months, it keeps getting extended. It presses their buttons, not everyone, but the plaintiffs that I saw. And the response is not good to being put on probation again and again and again for a year or more than a year. So,
well, so now I think now the audience has dwindled down to essentially my dad, who's below us, Papa Baudry below them. So I think it's the sign that it's time to call it a day.
Thank you very much.
Thank you very much.
It was really interesting to hear your
Thank you very much, everyone. Bye-bye.
Have a great day.
Bye-bye.